Greetings, Doctor. If you are new to Augma Bone Graft Cement or need guidance on which product to use, this 2-minute video was made for you. Augma has 2 bone graft cements. The first is 3D Bond Plus. 3D Bond Plus is a short-term space maintainer that comes in a 0.5 cc smart syringe, which provides convenience and ease of use. It is designed for cases where the bone deficiency is relatively small, such as socket grafting procedures. The second bone graft cement is Bond Apatite, a long-term space maintainer that comes in a smart syringe and intended for any type of bony defect. Bond Apatite comes in 1 cc syringe. Both syringes are indicated for single use. As a solution-based company, Augma offers Augma Shield, a wound dressing that adheres to the gums and protects the exposed graft until soft tissue proliferates. Augma Shield can be used after any grafting procedure with Augma Bone Cement products as an additional layer of protection. Specifically, it is used when the graft is left exposed and the gap is wider than 3 mm. This applies to clinical cases involving socket grafting procedures with or without flap reflection, lateral and horizontal augmentation, as well as other cases of 3-dimensional bone defects. To ensure optimal protection of the exposed graft, the Augma Shield should be firmly secured using cross-mattress sutures for a period of 12 to 14 days. This will allow for adequate soft tissue proliferation above the graft. Following this period, the sutures can be safely removed along with the remainder of the Augma Shield. Augma's bone cement protocols are completely different than traditional GBR. The surgical approach involves a minimally invasive technique that utilizes a single vertical incision, minimal flap reflection, and no periosteal releasing incisions or any soft tissue manipulation to gain a tension-free flap. The flap is placed under tension during closure. Primary closure is not mandatory. When the graft is left exposed, Augma Shield is recommended to protect the Augma Bone Cement from being washed out during the initial phase of healing, until soft tissue proliferation takes place over the graft. During graft placement, it is crucial to compact the material thoroughly as it sets in the presence of blood and saliva. The surgical protocols do not recommend using a membrane, and the material transforms completely into the patient's own bone. It is important to respect the protocols for your clinical success. To learn more about the surgical protocols per each product and its synergy with Augma Shield, you can take the online introductory courses. For socket grafting using bone graft cements, take the course for 3D Bond Plus. For multiple augmentation procedures using bone graft cements, take the introductory course to Bond Apatite. You can send any clinical question to info@augmabio.com, and we promise to answer shortly. Thank you for watching.